Welcome back. Tonight at 10, a look at breakthrough medications for patients in the fight against cancer.
For those who've battled cancer, chemotherapy can be very difficult, but these new treatments, one approved by the FDA in recent months, they're giving patients a sparkle of hope in their fight, especially against gynecologic cancers that kill more than 30,000 women in the U.S. each year.
The symptoms are so quiet. You don't know what you've got. And I just had a twinge. I call it a persistent twinge in my lower stomach.
It was 2014 when Laurie McAndrews was first diagnosed with stage 3C ovarian cancer. Within a week of that diagnosis, surgery, and then months of chemotherapy.
End of the 18-week treatment, I was considered no evidence of the disease, so ecstatic, you know. I was like, okay, this is it.
But as is the case with some cancer patients, it came back 18 months later.
I fully expected to hear again, no evidence of disease, you know. I figured, oh, I've beat it. Well, it wasn't all gone, but it's very small and manageable.
About the time Laurie was first diagnosed back in 2014, researchers made a breakthrough.
What's happened in ovarian cancer over the last 3 years is a huge insurgence of FDA approval for new medications, and that can be used both upfront and in the recurrent setting.
They're called PARP inhibitors. It's a big name for 3 different types of chemo drugs that basically attack the bad cancer cells, leaving everything else as it should be.
So when we use targeted therapy, the idea being is that we're actually successfully targeting the bad actors in the patient's body and allowing the rest of their body to go on business as usual. It's a revolution.
Laurie's primary caregiver at the UW's Carbone Cancer Center, Dr. Lisa Barolette, made Laurie part of the revolution.
We don't know that PARP inhibitors alone are going to really completely counteract cancer's growth, but we do think it can slow it significantly.
I'd read a little bit about it, so I was very excited. I was like, oh, really? I get to be a part of that without a trial? I mean, because I knew it had been in trials.
It's also administered orally with pills, so Laurie, who lives in northern Illinois, doesn't have to travel to Madison to go through grueling traditional methods of chemotherapy.
I'm doing great. No side effects. It's working for me, and it's just pills, 2 pills a day.
It's still chemotherapy. These drugs certainly still have side effects, but the idea that you can take that medication at home and have the freedom in your day and in your life to fit in your chemotherapy treatment that quickly is totally different from anything we've been able to offer patients in the past.
And for Laurie, that's allowing her to live life to the fullest.
I've got 8 grandchildren, so now I have time to go to their events, take them running around. Before it's like, no, I have no energy. Now it gets me out there, and I'm feeling really good.
She's another warrior in the Carbone Cancer Center's fight to wipe out a silent killer.
We have so much work to do. I don't want to make it sound like we've won this war, but I do feel, and this is the first time I felt this way in several years, that we've just won a major battle.
The UW Carbone Cancer Center will hold its annual Sparkle of Hope Gala benefit Friday night, October 20th at Monona Terrace.
It has raised over $630,000 since it was first held 10 years ago. And we have a link to ticket information on our website, channel3000.com.